Well, welcome back to Good Morning San Diego. March is National Endometriosis Awareness Month. An estimated 11% of women between the ages of 15 and 44 in the United States are affected by this condition, myself being one of them, actually. Here to tell us more about endometriosis is Dr. Chandra Spring-Robinson from Sharp Memorial Hospital. Good morning to you. It's good to see you in my office versus on your work day.
I know, a little turnaround here.
And for our viewers at home, Dr. Spring-Robinson has been my surgeon, is my surgeon and my doctor, helping me to treat this condition that we don't know much about, but you are an expert at. So first, tell us, for anyone who doesn't know, what is endometriosis?
So to start, endometriosis is a chronic inflammatory disease that affects women. And more specifically, it's when tissue, like the lining inside the uterus, grows throughout the pelvis. Now, some women are completely asymptomatic, but most have significant pelvic pain during their cycles. It can cause GI pain, it can cause pain with walking, exercise, and so as time goes on, as more cycles occur, the more pain the patient can be in. It can also, it's a huge factor in infertility too.
Right, and a lot of people, I think, a lot of women have struggled to get it diagnosed because there's so many unknowns, and also just, it's hard to diagnose, right? A lot of people chalk it up to just having a painful period, which is only one small part of it for some women, right? There's some women that could have absolutely no pain whatsoever, but then they go into surgery and all of a sudden it's littered everywhere. So just talk to us about maybe some of the misconceptions with the condition.
So one huge thing is that it takes 7 to 10 years for a woman to be diagnosed with this condition in the United States currently. There is a huge delay in care. And one of the reasons why is that it is genetic. So a woman has painful period, but their mom had painful periods and their grandmother had painful periods. So this is a part of life. And it's okay all of a sudden to be missing 2 days of school, to not be able to make it to your sports game, to not be able to make it to work and actually try and be able to get out of work at least 2 to 3 days out of the month. So it became the normalized that pain is okay when it's not. The pain is not okay and it needs to be addressed. And so that is where a lot of patients, I think, get lost. And to the point where they basically could lose jobs, not be able to take care of their children, and it creates a huge impact on our society in that way.
Right, and also, you know, when I was going through my diagnosis, and again, when you talk about something that it impacts work, right? I have to be on camera every single day. Exactly. I have to come and bring energy. But when those moments of pain hit, it's really hard to get through it. And I thought, oh, maybe I just have a really high pain tolerance. But then, you know, when I finally started to see you and talk more about the condition, what surprised me is that you can only officially diagnose endometriosis by doing the surgery. It doesn't get picked up in ultrasounds, right? It doesn't fully get picked up in scans and MRIs. Why is that? And why is surgery the only way that we can actually see and diagnose it?
Well, so interesting enough, a recent article just came out by the ACOG that basically pushes us to be able to make a clinical diagnosis so we can get patients to treatment faster. So currently, yes, the only way that we felt in the previous and like early right now is to be able to diagnose surgically, to be able to see it. One of the reasons we can't be able to see it is with ultrasound, sometimes the lesions aren't dense enough. Sometimes if it's not changing the anatomy, we don't see those changes. MRI, we can sometimes see deep infiltrating endometriosis. I've had patients who've had stage 3, stage 4 disease have completely clean imaging. And then I've had patients with stage 2 where we're able to see the endometriosis. So a lot of this is based upon, like, first we try to do an ultrasound. We do basically endometriosis mapping within my office. And then from there we might need an MRI, but overall the best way to deal with it is with surgery.
Surgery and then the after treatment, which you and I have been working on for almost a year. I had my surgery last April, which is diet, exercise, mental health. Because what's interesting that I learned as well through this process is that endometriosis is technically a full body disease. And how do you treat that if, you know, before surgery you don't know where it is and how it's impacting your body? So just talk to me a little bit about that aspect of it, maybe the stages of it and your approach to treatment.
So the main way women deal with the pain, I think, for multiple years before coming to see me is they take NSAIDs to the point where they have gastritis and they can't even take the NSAIDs anymore, which is basically non-steroidal anti-inflammatory, right? So with that, by the time they see me and we get through the surgery, we still have to deal with the chronic inflammation. Sometimes there's bloating, so we want to send you to GI, test you for different conditions that way. We want to be able to send you to acupuncture to help naturally decrease your inflammation. We also do pelvic floor therapy to basically help with muscle function. It's a whole body disease that needs to be treated like the whole body. It's also basically trying to do supplements. And of course, there's always birth controls or hormone medications that sometimes are necessary depending on the patient.
Right.
With endometriosis, a lot of patients actually can't tolerate birth control.
So I do want to mention that you also are a huge advocate for bringing awareness. And one of the ways you're doing that is through a free public event through Sharp Healthcare. And that's going to be on Saturday, March 28th. We have the information right here from 1:30 to 4:30 at Sharp Healthcare on Spectrum Center. What do you want people to know about that, women and men? Because we all need to get a little bit more informed about this condition.
Family members are the huge support network for patients. So it's very important that significant others do become involved and understand what their partners, what their loved ones are going through. This event, though, the reason why people should go to it is because it's not just me talking as an endometriosis excision specialist, it is also the colorectal surgeon who helps. It is the acupuncturist, the IVF doctor, the gastroenterologist, the pelvic floor therapist. It's all coming together of all these different physicians that you may need to see, that you want to hear their perspective on how this disease is treated and how they can help.
Right, and I appreciate you coming here this morning. You are a very busy woman. I know this because we have limited time even at the doctor's office, but it's also been a pleasure to be able to have you help me on my health journey, and I know that you've helped so many women across San Diego and across the country. So thank you so much for your time.
Thank you. I really appreciate being here today.
Thank you.